Healthcare on the reservation is challenging for people to get the care that they need. Number one, we're so remote. If somebody needs something outside of the services that we provide, they have to be referred out to Rapid City or Sioux Falls, and that's 3 or 4 hours away. We have a very large geographical area that we have to cover, and that becomes challenging for patients who are trying to gain access to health care. So just actually getting in the door and being able to see a physician, a provider, and get the care they need is absolutely challenging just on a daily basis. The idea of providing health care here looks and feels a lot different than it does in the private sector. Our patients have a lot of other challenges that become priority. You have people who don't have their basic needs met. They don't necessarily know where their next meal is going to come from. They don't know where they're going to stay. They're more concerned about tending to their children, their loved ones, than they are about their own health. So that creates barriers to ensuring that patients are coming in routinely for preventative care. That is the patient's challenge to obtaining and accessing health care. Our people have paid dearly with their life, with their land, with their health. There's a common misconception that healthcare is free for Native Americans, and that's not true. IHS is not health insurance. What Indian Health Service does is provide direct services to federally recognized tribal members.
To be able to use an Indian Health Service facility, you have to be an enrolled tribal member of a federally recognized tribe, or if you can prove lineal descent. I don't think you'll hear from anyone that it's fun or easy to go get care at IHS. There are quite a few limitations in care. If you have any kind of complex disease, like you have cancer, you can't get the radiation and chemotherapy at most Indian Health Services. You'll get referred out to a non-IHS facility, and that's where there's a gap in coverage. The IHS isn't an insurance program, so it doesn't follow you wherever you go. You have to take work off, then you have to arrange for your kids and worry about lodging and meal costs and gas costs.
If a person doesn't have the money to get their health care, they'll put it off until it's at a point where they have to go to the ER. The charges are more. The medications they may need are going to be quite expensive. Then they're stuck with a giant bill. With Medicaid, any Native American that is enrolled in the Medicaid program, the federal government pays 100% of that bill. So none of the money comes out of the state's pockets. With Medicaid expansion, we can help people get health care coverage in South Dakota.
My name is Cecilia Spotted Tail. I live in Oak Creek, South Dakota. I've lived here for 31 years. I think it's the open space, being able to see as far as your eye can see. We all live a really fast life, and I've had a chance to slow down and reconnect with nature, with plants, animals, the surroundings outside, being able to sit down and enjoy a cup of coffee and not have to go. I realized something was going on when I laid on my stomach one night and I felt a bump. I just kind of thought, I wonder what that could be. Fear kind of came over me, and the first thing that entered my mind was cancer. When I had an exam with the doctor, he couldn't find anything. They said there was nothing. Going to IHS and having the doctor tell me, "You're fine." I came home thinking, it's not fine. Tried to not think about it, but it just kept getting bigger and bigger. After about 3 months, when I went back for a follow-up, he could feel it then. They decided to refer me to Pine Ridge, and so I was scheduled for ultrasound. The doctor there had said I had a significantly large tumor. The tumor was 8 pounds. he could schedule me for surgery there, but it would require for me to be cut below my abdomen about 12 inches. I thought to myself, there has to be something more. So I found this doctor in Sioux Falls, and she had told me about another way she could remove the tumor out of a 2-inch incision. That was the other option to being cut 12 inches. She was my hope. He said, well, you don't have insurance. I had offered to purchase healthcare through the marketplace, but IHS wasn't going to cover the surgery.
Indian Health Service is not health insurance. IHS is funded through the federal government to provide direct services. There is a program called Purchase Referred Care, and that has a separate budget, and that budget is used to refer patients out for care. The problem is that the budget itself is probably half of what the need is. They can pay themselves, which we all know how expensive healthcare is, or they just don't receive the care at all. And oftentimes that's what happens based on medical priority and what they have in the budget. Either they approve them or they deny them. So patients are typically denied for anything that's not life-threatening. They're trying to get the care that they need, and they're at the mercy of this program, and it's not the fault of the people that are working there who are trying their best with limited resources, but really that's what it comes down to. There just isn't enough funding from the federal government to provide the quality of care that's needed for the people on the reservation.
When I found out from IHS Contract Health that my surgery couldn't be paid by the doctor that I found to do it the less invasive way, I sought out the CEO of the hospital, and I waited for him for 2 days. And I asked him, if this was your daughter, your wife, or your mother, would you approve this surgery for them? The next day, he approved the surgery. The extent of my advocacy was beyond what people probably ordinarily do without healthcare. Without somebody guiding me, I basically had to find that path myself. I had to. It was like life or death for me. The people that live here on this reservation where I live don't often have private insurance or Medicaid. IHS has been our primary healthcare provider, and it's all we've ever known. So there's like a huge gap. In my situation, IHS wasn't enough. Hope for my future looks like having insurance, to be able to have one provider that you can see, that can get to know you. They know your issues, because at IHS we see so many different providers. Medicaid or private health insurance would ensure a future that looks like we build a relationship with one provider. I would feel relieved to know that my children had the health care that they need to address any health issues.
Medicaid expansion would greatly help all of our South Dakota people that do not have any kind of health care. It would give them the ability to get their medication and not have to choose between buying groceries or getting their medicine.
It's people that are working, that are making just a little too much to qualify for Medicaid, and they don't get health care through their employer. And those are the people we're helping. Anyone you run into who's serving you your coffee at Starbucks or who's taking care of your child at daycare, those are the people that will benefit from Medicaid expansion. By not expanding Medicaid, there's dollars left on the table that really could be put to important things. We would see the direct impact right away if we had Medicaid expansion. If we leave those dollars on the table, there are people that aren't going to get the care that they need. Our health disparities are going to continue to rise. That just has a domino effect on the rest of the community trying to make up for that person's care.
Our duty as Americans and as South Dakotans is to make sure that we're advocating for our families, our friends, and our neighbors. The best way to do that and the best way to really affect change on a large scale is to get out and vote.
If I had access to Medicaid expansion, it would allow me to be more proactive about my health care, to be able to be that advocate for my people who have been here, passing down knowledge of community and culture and heritage, and help me live a longer life. I would say to the people of South Dakota, go vote yes on Amendment D in November.